Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Porphyria. Introduction. Porphyria is a term that refers to a group of genetic disorders. This group is sometimes called the porphyrias. Porphyria mainly affects the nervous system or skin. Sometimes it can affect both. Porphyria is caused by problems with how your body makes a substance called heme. Heme is found throughout the body, especially in your blood and bone marrow, where it carries oxygen. This program explains porphyria. It covers the symptoms, causes, diagnosis, and treatment of the disorder. What is heme? Heme is a chemical compound that contains iron. It is what gives blood its red color. The largest amounts of heme are in the blood and bone marrow. Heme is found within red blood cells in the form of hemoglobin. Hemoglobin is a protein that carries oxygen from the lungs to all parts of the body. Heme can also be found in the liver. Heme is a part of proteins that have many functions. These functions include breaking down hormones, drugs, and other chemicals, generating high-energy compounds that keep liver cells alive and working normally. The body makes heme mainly in the bone marrow and liver. Each step of making heme is controlled by one of 8 different enzymes. Enzymes are proteins that help chemical reactions happen in the body. If the body does not have enough of any one of the enzymes to make heme, the process is disrupted. As a result, chemicals called porphyrins can build up in the body tissues. This causes the illness porphyria. Symptoms. There are many different types of porphyria. The 2 main types are acute or cutaneous. The symptoms vary depending on the type. Acute porphyria affects the nervous system. Common symptoms of acute porphyria include muscle numbness, tingling, paralysis, or cramping, personality changes or mental disorders, pain in the abdomen, chest, limbs, or back, constipation or diarrhea, vomiting. Acute porphyria can also cause fever, trouble urinating, urine that looks red or brown. Acute porphyria may also cause anxiety or paranoia, dehydration and excessive sweating, difficulty sleeping, hallucinations, high blood pressure, seizures. Cutaneous porphyria affects the skin. People with this type of porphyria develop blisters, itching, and swelling of the skin when it is exposed to sunlight. Some types of porphyria can affect both the nervous system and the skin. People with these types of porphyria may have symptoms of both acute and cutaneous porphyria. Symptoms can vary greatly in severity. Some people may have no signs or symptoms of the disorder. These people are said to have latent porphyria. People with porphyria do not have symptoms all the time. Certain triggers can cause an attack of porphyria. These include some medicines, smoking, drinking alcohol, infections, stress, and sun exposure. Other triggers of porphyria include certain diets and fasting, certain hormones like estrogen, too much iron. Attacks develop over hours or days. They can last for days or weeks.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. There are many types of porphyria. Most types of porphyria are inherited. This means that people with porphyria get it from their parents. Genes tell the body to build certain substances. Every person has thousands of genes. Our genes make us look the way we do. They also have something to do with our health. Each person has 23 pairs of chromosomes. Genes are found on the chromosomes. There are many genes involved in heme production. Genes can either work correctly or incorrectly. If a gene does not work correctly, it is called defective. If one of the genes involved in heme production is defective, the body will not have enough of one or more of the enzymes that help produce heme. The type of porphyria a person has depends on which enzyme the body is lacking. Less often, porphyria may be acquired rather than inherited. This means that it is not caused by defective genes. Instead, these types of porphyria are caused by the effects of certain diseases or exposure to chemicals. Diagnosis. Symptoms of porphyria are similar to symptoms of other disorders. This can make porphyria hard to diagnose. Your healthcare provider will ask you about your symptoms. He or she will also perform a physical exam. If your healthcare provider thinks you may have porphyria, lab tests may be done to confirm it. Blood, urine, and stools tests are used to diagnose porphyria.
Since diagnosing the different types of porphyria can be complex, your healthcare provider may need to do several rounds of tests.
Treatment. Each type of porphyria is treated differently. It usually involves medicine, treatment with heme, or drawing blood. Treatment for acute porphyria includes relieving symptoms. Medication may be prescribed to control pain. Treating any infections or other underlying illnesses that may have caused a porphyria attack is also important. Hemin or hematin injections are often used. Hemin and hematin are forms of heme. Giving the body heme can help reduce porphyrin levels. Severe attacks may require hospitalization for treatment. Intravenous fluids and other nutrients can help keep the body hydrated during an attack.
Givosirin, Givlari injections may lower the number of attacks of acute hepatic porphyria. Potential side effects include severe allergic reaction and damage to the liver or kidneys. Ask your healthcare provider to learn more about the benefits and risks of this treatment.
Treatment for cutaneous porphyria focuses on reducing the amount of porphyrins in the body. This helps to relieve symptoms.
Limiting exposure to sunlight can help treat cutaneous porphyria. Avoid direct contact with sunlight when possible. Wearing long sleeves and a hat can help protect your skin. Use sunscreen when you go outside.
Phlebotomy can help reduce iron and porphyrin levels in the body for people with cutaneous porphyria. Phlebotomy is drawing blood, which contains a lot of heme, from one of the body's veins. It may need to be done several times before symptoms go away. Medication may be used to treat cutaneous porphyria in people who cannot have phlebotomy. Drugs used to treat malaria absorb extra porphyrins quickly and help your body get rid of them. Daily doses of beta-carotene or other carotenoids may be used as long-term treatment for cutaneous porphyria. The body uses beta-carotene to make vitamin A. Vitamin A is needed for healthy skin and eyes. It may help skin become more tolerant of sunlight. Avoiding triggers can also help prevent attacks of porphyria. Porphyria can be triggered by many different environmental factors that can be difficult to avoid. Talk to your healthcare provider for tips to prevent attacks.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Porphyria is a term that refers to a group of genetic disorders. This group is sometimes called the porphyrias. Acute porphyria affects the nervous system. Cutaneous porphyria affects the skin. Some types of porphyria can affect both. Porphyria is caused by problems with how your body makes heme. Heme is found throughout the body, especially in your blood and bone marrow. 8 different enzymes are needed to make heme. If the body does not have enough of one of the enzymes, a person has porphyria. The type of porphyria a person has depends on which enzyme the body is lacking. Most types of porphyria are inherited. Less often, porphyria may be caused by other disorders or exposure to chemicals.
Symptoms of porphyria are similar to symptoms of other disorders. This can make porphyria hard to diagnose. If your healthcare provider thinks you may have porphyria, lab tests may be done to confirm it.
Each type of porphyria is treated differently. Treatment usually involves medicine, injections of heme, or drawing blood. Avoiding triggers can also prevent future attacks. Thank you for using Explain.